On Thursday morning, last Thursday morning, about mid-morning, 10:30 or so, we were notified by the health department that there was a possibility that some samples sent off, some H1N1 samples sent off that may be positive. We did not know yet for sure because they were running the test again. That was not confirmed until about quarter to one on Thursday.
The first case was identified in North Carolina on May the 3rd, and it was initially called swine flu. We're no longer calling it swine flu. The name by the CDC is H1N1. Now, this virus behaves like other influenza viruses in that it's spread by what we call respiratory droplets. When you cough, and you cough out droplets, or you sneeze droplets, that can contain the virus. And those droplets generally travel a short distance. They're what we call the heavy particle droplets. So they travel somewhere from 3 to 6 feet. Now, they can contaminate people if you cough directly onto people, or they can contaminate surfaces. So it is thought that they can live anywhere from about 2 to 8 hours on surfaces. That's why part of our public health messages are so important, that you wash your hands, that you disinfect surfaces, that you don't touch your hands to your face, that you cover your cough in your sleeve. All these things to try to minimize contact. And then obviously the most important one, to stay at home if you're sick. So once someone is exposed to this virus, if they're going to develop it, they're going to develop it generally between 1 and 7 days. Most people are developing it between 1 and 4 days. And their symptoms predominantly have been fever, cough, and sneezing, sore throat, runny nose, aching, fatigue. Some people have noted shortness of breath. Some people have had vomiting. Some people had diarrhea. Our largest collection of cases have been in the New York City outbreak, and in New York City, 95% of the patients there had fever and either cough or sore throat. So there are some groups that tend to be at higher risk that we worry about for seasonal flu, and it's the very same risk groups as for this novel H1N1 influenza virus. And those groups that we pay special attention to, because they're called our high-risk groups, are those at the extremes of age, and that is the children less than 5 years old and persons greater than 65 years old.
The World Health Organization on their website today mentioned that there are more than 17,000 cases worldwide. That compares with 13,000 cases last week when I called the press conference. The Centers for Disease Control now report 10,053 cases in the United States. Last week during the press conference, there were 8,000 cases. In North Carolina, there are currently 22 cases in 10 counties. Last week, including our cases, there were 18. So there's been a lot of movement even since last Thursday.
To see if these 4 children had contact with anyone in Craven, Carteret, or Onslow counties, because those had confirmed cases also. Sure. So that was one of the callbacks to these families, was did they travel to those counties? Did they have visitors from those counties? And the answer was no in all cases. So we don't know exactly how it arrived in our county.
We also had found out that these 4, none of which had left Wilmington in the 7 days before they got sick. Now, so therefore, we have to believe that they caught it with somebody locally who may have been traveling. And, you know, we're a very fluid society. I mean, we come and go from all kinds of states. And so it may take us a long time, or we may never figure it out how it got from Hanover County. But it was inevitable.
I'm a parent of a Gregory student, and my question is for the faculty here at Gregory. What is being done to clean the classes, if anything?
Both schools, Gregory and Snipes, were both cleaned. We augmented the custodial staffs at both of the schools, and they have been cleaned in accordance with the protocols and procedures put out by the CDC and the health department. So
What are those
they used antibacterial cleaners, which we normally use anyway. We have one already that we use every day that is one of the ones recommended by EPA and everyone for elimination of germs. And so they followed those procedures. They cleaned everything. They actually did it twice. So they cleaned everything, washed it down, and then they applied the antibacterial cleaner on the surfaces, let it sit for a while, then they cleaned them again.
On
So
the
they've gone
desks
through that
and so forth?
everywhere. Yes, everywhere. They
The
cleaned
toys?
everywhere. Everything.
I have one other question. The classes that were involved, did you do extra cleaning in those classrooms?
We cleaned everything the same. Everything was done the same. I mean, every extra cleaning was done on every surface in the schools, all the schools.
But since the H1N1 virus became a problem or became a concern in the northern hemisphere, we've been working very, very closely with our health department. In fact, we have a representative of the health department in each of our schools, and they're called school nurses. Our school nurses are employees of the health department, and we contract with the new Hanover County Health Department to provide these nurses in our schools. The interesting thing about this is it's not a requirement of the North Carolina Department of Public Instruction or the legislature to have school nurses. We work with the health department as partners to do this because we think it's very important. And here's an opportunity to show you why it's important.
Our school nurses are also monitoring that these children don't come back to school for 7 days. So that's their major role, is to feed us information at the health department, to call Vivian or their supervisor and let us know when they have a lot of sick children with the same symptoms, or if there are any issues or concerns that we need to know about. We're in direct contact with them regularly, but they are getting all the same information that we get, in our building, because they're part of our system, and they will be monitoring at all times and trying to do the best job they can of getting sick children to go home.
We encourage you to send them to school, but you're the parent, and in this particular situation, we're not going to try to be dictators to you and tell you what you must do. We're going to be very lenient with these two schools, but at the same time understanding that this is an important time for children, and we'd like for them to be in school.
Like to be here.
Right. But to answer your question, will the children be penalized in any way for not being in school with these two schools? The answer is no, ma'am.